name is Christina. I'll be doing my Foley catheter video. I have all my supplies and I'm ready. I'm going to go ahead and get started. Close the door for patient privacy. Hi, Mrs. Smith. My name is Christina. I'll be your nurse today. Can you please verify your name and date of birth, please? Okay, verified on our wristband. That was correct. Perform hand hygiene. Mrs. Smith, I'm here today because I'm going to go ahead and place a Foley catheter per doctor's orders. This will help empty your bladder. Looks like you're retaining urine. Does that sound okay? Okay, great. I'm going to go ahead and place you in the correct position. I'm going to go ahead and lay you down. I'll walk you through the procedure. If you feel any pain during anything, please let me know. You shouldn't feel any pain. Do you have any questions? Okay, perfect. Mrs. Smith, I'm going to go ahead and have you lift up your legs, bend your knees, and point them outwards. Okay, perfect. I'm going to go ahead and lift the bed to a good working height for me. I'm going to go ahead and put my gloves on. Mrs. Smith, I'm going to go ahead and clean the perineal area first with some no rinse soap and my washcloth, and then I'm going to dry it. I'm also going to inspect to see if there's any cause of concern while I'm doing that. Does that sound okay? Okay. I'm going to go ahead and lift your gown. Is that okay? All right. Okay, Mrs. Smith, I'm going to go ahead and start cleaning. You will feel me touch you down there. Is that okay? Okay. Okay, we're going to go ahead and clean farthest from us first, from the top down. Get a new part of our rag. Clean closest to us now, top down. Get a new part of our rag. Then we're going to clean from the top down in the middle. Okay, I'm going to go ahead and dispose of that. Okay, I'm going to go ahead and examine. Everything looks great, no cause of concern. I found the urinary meatus. All right, we're going to go ahead and dry that. Are you feeling okay, Mrs. Smith? Great. Okay, I'm going to go ahead and dispose of that. I'm going to go ahead and dispose of my gloves. I'm going to go ahead and perform hand hygiene. All right, Mrs. Smith, we're going to go ahead and get started with the catheter. This is a sterile process. I just want to let you know to be very careful. Try not to kick or move anything. We don't want to break sterility. And do you have any questions? All right, we're going to go ahead and get started. I'm going to open up our sterile kit. I'm going to go ahead and toss this and not use it as a trash bag. I have a trash bag next to Mrs. Smith's hip for ease of access. So I'm going to go ahead and toss this on my trash on my right. Okay, we're going to go ahead and get started. And we want the part that's closest to us to open last. Okay, I'm going to go ahead and remove my sterile gloves from the kit. I'm going to go ahead and open my sterile gloves. Throw away my trash. I'm going to go ahead and move my sterile kit because I don't have enough room, so I'm going to just move it. Obviously, I wouldn't do that in real life because I'd have enough room, but I'm going to go ahead and don my sterile gloves. Oh, I'm also going to move this box so you can see me doing that. Carefully only touch this 1-inch border while we're donning our gloves. Okay, I'm going to go ahead and take these 2 fingers, grab the cuff of the glove, insert my hand, making sure I keep that cuff folded so it doesn't roll down my wrist. I'm going to go ahead and take 3 fingers, go under my second cuff, guide my hand in there. Okay, again, making sure it stays folded so that it doesn't roll down. Make sure they fit. I'm going to go ahead and grab the middle where it's sterile, and I'm going to toss it in my trash can to my right. Okay, and for the purpose of this video, I'm going to grab the sterile kit and move it back so I have enough room. Okay, next thing I'm going to do is grab the drape, making sure I only touch the 1-inch border on the drape as well. Mrs. Smith, I'm going to go ahead and have you lift your hips up so I can place this underneath you. Okay. Normally I wouldn't have to move the modular, but for this video, I had to lift it up. Okay, I'm gonna go ahead and move the box. I'm gonna go ahead and get started. I'm gonna go ahead and put this over Mrs. Smith's perineal area. Okay, I'm gonna go ahead and get my catheter ready. Mrs. Smith, are you feeling okay? Perfect. Okay, first thing I'm gonna do is remove my alcohol swabs. Throw away my trash. I'm gonna go ahead and empty the lube. Okay, throw away my trash. I'm gonna go ahead and remove the cover on the tip of the catheter. Toss that. Okay, I'm gonna go ahead and grab the syringe with 10 mLs of sterile water, and I'm gonna go ahead and put it in the port of the catheter. Take the tip off first. Okay, now I'm gonna take the tip of the catheter and place it into the lubrication. Okay, Mrs. Smith, are you okay? Feeling okay? Okay, perfect. Mrs. Smith, I'm gonna go ahead and clean the perineal area with my swabs. It might feel a little cold. I don't want you to feel startled. Okay, so I'm gonna grab one of the swabs first, and now this hand is gonna become my non-sterile hand because I'm going to be touching the patient. Again, we're gonna swab from the farthest from us, from top to bottom. Dispose. Take another swab, clean closest to us from top to bottom now. Dispose. Grab our last one, we're gonna clean the middle of the area from top to bottom. Perfect. Okay, Mrs. Smith, we're gonna go ahead and start inserting the catheter. Are you feeling okay? Okay, perfect. When I'm gonna have you breathe in and exhale. When you exhale, I'm gonna go ahead and insert the catheter. So when I tell you to breathe in, do so, okay? All right. Okay, I wanna hold 2 to 3 inches from the tip. Okay, Mrs. Smith, I want you to breathe in and exhale. I'm gonna go ahead and insert the catheter now, 2 to 3 inches. Okay, I'm starting to see urine come out. I'm gonna go ahead and insert the catheter 2 more inches. Okay, perfect. Now with my non-dominant hand, I'm gonna go ahead and grab the catheter so it stays in place. With my sterile hand, I'm gonna go ahead and inflate the balloon with the 10 mLs of sterile water. Okay, I'm gonna go ahead and remove the port from the port. Okay, I'm gonna go ahead and dispose of this. Okay, I'm gonna go ahead and pull the catheter till I feel some resistance. Okay, perfect. Okay, Mrs. Smith, the catheter is in, everything looks great. How are you feeling? Okay, good. Okay, so now we are going to take this out. I'm gonna go ahead and put a stat lock on her inner thigh so this can stay. I wanna make sure it's clamped so it doesn't have too much pull on it, but a little leeway so it doesn't pull too tight. Okay. I'm gonna go ahead and clean up my area now. We're gonna go ahead and tear this. Okay, and Mrs. Smith, I'm gonna go ahead and clean you up a little bit from the lube and the Benadine swab. Okay, I'm gonna go ahead and take this. Ms. Smith, lift your hips. Perfect. Okay, I'm gonna go ahead and dispose of this in my trash. Okay, I'm gonna go ahead and remove my gloves. Dispose of my gloves. Okay, Mrs. Smith, I'm gonna pull you back up to a comfortable position. Are you comfortable? Okay, perfect. I'm gonna go ahead and hang this catheter bag on the bed frame, not the bed rail. Okay. Mrs. Smith, I want to let you know if you need to get up to move or anything, please use that call out and call me. I don't want you to trip or fall with the catheter. Again, if you do have to move or anything like that, please make sure the catheter bag is below your bladder at all times. If you have any questions, please let me know, and I'll be happy to answer them. Are you in a comfortable position, Mrs. Smith? Okay, perfect. I'm gonna go ahead and perform hand hygiene. I'm gonna go ahead and leave, close the door for patient privacy, and I'm gonna go ahead and document my findings.